Shivani.
So, good morning everyone. As we all know that the management of neovascular glaucoma is challenging because of elevated IOP, retinal ischemia and multiple systemic risk factors. Also, the conventional filtering surgery is bound to fail. So consequently, we have tried to, we all know that glaucoma drainage device offer a safer and effective alternative to management, persistent, mainly due to Ahmed glaucoma valve. So these are the abbreviations I've used in my presentation. We all know that ischemic central retinal vein occlusion, PDR, and OIS are the most common causes of neovascular glaucoma. Now, the management strategy involves dealing with multiple risk factors, either sequentially or concurrently, which includes treatment of IOP, managing systemic conditions, and treatment of retinal ischemia and inflammation. While talking about our learning from literature, what we know that in routine clinical practice, glaucoma drainage devices are reserved for eyes with persistent new vessel or high risk of trabeculectomy failure, or wherein the filtering surgeries are not feasible. So in our study, we tried to evaluate the long-term surgical outcome of Ahmed glaucoma valve implantation in patients with neovascular glaucoma secondary to various etiologies. Ours was a retrospective studies wherein we included 27 eyes or 27 patients diagnosed with NVG. Our groups were comparable. The patients in other category included patients post-occlusive vasculitis and retinopathy of prematurity. So we included all the patients who have undergone AGV implantation secondary to neovascular glaucoma with a minimum 3-month post-operative follow-up. The eyes with no light perception vision at presentation were excluded, and the eyes with less than 3 months follow-up were also excluded. While the primary outcome measure was AGV success, which was defined as IOP between 6 to 21 millimeter of mercury without a topical anti-glaucoma medication, the failure was defined as one of the following, where the IOP was more than 21 despite maximum tolerated medication. There was need for additional surgery to control IOP, or there was loss of light perception due to surgical complication. While talking about hypertensive phase, it was characterized by IOP more than 21 despite initial post-op reduction within first 3-4 months after surgery with accompanying cystic and tense bleb. A resolution was defined as IOP less than 21 with a reduction in AGM, and to proactively prevent hypertensive phase, we have started patient on aqueous suppression. So the statistical analysis was performed using SPSS version 26.0, and p-value less than 0.05 was considered statistically significant. So in our cohort, which predominantly had male with a median age group of 61 years, there was maintenance of visual acuity in the post-op period with a reduction in IOP, which was maintained over all the follow-up, and a reduced dependence of anti-glaucoma medication. While talking about comparison with the group, as we see here, there is no statistically significant difference, but patient in OIS category seem to benefit more with AG1 implantation in terms of gain in visual acuity as well as reduction in intraocular pressure. The median and mean survival times were better in the OIS and CRVA group and less in PDR group because of the progressive nature of disease and a higher IOP at presentation in the PDR group. So complications, there were 2 complications, tube exposure noted in CRVA and PDR group, and 2 patients underwent TSCPC in PDR and OIS group for uncontrolled IOP. While comparing with literature, our study showed a better outcome in OIS and CRVO group as compared to PDR group because PDR group patient had persistent neovascularization as well as worse visual acuity at presentation. So the strength of our study has that we have directly evaluated and compared the outcome of AGV among the 3 common etiologies of neovascular glaucoma. The limitation includes the retrospective nature of study with the irregular follow-up of patients due to COVID-19 pandemic and a smaller sample size. So we can conclude that AGV implantation can be considered as an effective surgical option to reduce IOP and number of anti-glaucoma medication for neovascular glaucoma varying etiologies. Thank you.